Imagine waking up every day feeling vibrant, energized, and looking as young as you did years ago. It might not be just a dream much longer. And as we age, our bodies begin to change, and rarely in a good way. Things begin to expand, sag, and or droop. And unfortunately, there's just no beating back father time. Or is there? From hair growth meds to metabolism, boosting nutrients, and skin rejuvenation formulas, we're sharing with you the best advice on how to fight aging. Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Marissa Mauricio, Clinical Pharmacy Specialist, Wellness and Weight Management at Baptist Health, are standing by to help separate the fact from fiction and answer your questions along the way on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
I'm Kathy Buccio, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers. Our first question comes from Laszlo, who reached out to us through our website, allhealthtv.com. And Laszlo's question is, hey, Dr. Camejo, so what's the deal with getting older? Is it all genetics, which means there's nothing we can do about it? My dad is 55, but looks about 70, and I don't want that to happen to me. Doc, tell me you got some tricks up your sleeve. Dr. Camejo, I know you're a magician in the pharmacy. You can get any spells or potions that can help Laszlo, and you know what? Me too. Retain his youth. So I wouldn't mind getting some of that action and some of that information. What do you say?
So, hi, Laszlo. Genetics is definitely part of the equation, but that's not the whole story these days. And today we can actually slow down the aging process. Even though genetics do play a role in how we age, they aren't the whole story. Now, research shows that lifestyle factors like nutrition, exercise, sleep, stress management, even social connections have a huge impact on aging. Now, your dad's experience doesn't have to be yours, but you can slow down the aging by focusing on healthy habits now, like strength training, eating a nutrient-dense diet, managing stress, and even prioritizing sleep. Ideally, you want to get at least 7 to 9 hours of sleep and focus on consistent sleep patterns, which can contribute to healthy aging. Now, longevity is less about luck and genetics than more about the daily lifestyle choices we make.
Heads up, docs, we got a hair-raising question from YouTube from Camila, and she wants to know, Dr. Camejo, I like to say that I'm asking this question for a friend, but it's really for me. What are the most common causes of hair loss, and how do they differ between men and women? I'm asking because my hairdresser just noticed that my hair is thinning and suggested I talk to a doctor. Dr. C&M, this is a really delicate question, but a great question. I'm sure a lot of women can identify with this. What do you say, Dr. Camejo?
You know, Kathy, I'm afraid you're right, but Camila, don't despair. There's a lot of things that can be done these days to reduce thinning hair, as well as promote regrowth. I think, Dr. Mauricio, why don't you take this one?
Yeah, so hair loss has many causes, including genetics, hormonal changes, nutrient deficiencies, stress, and even medical conditions. In men, male pattern baldness is often linked to genetics and testosterone metabolism. This is due to an androgen called DHT, which can sometimes contribute to female pattern baldness as well. And women can also experience thinning hair due to hormonal shifts, particularly during menopause or conditions like iron deficiency and thyroid imbalances. If you're noticing thinning hair, it's worth checking your nutrient levels, such as your iron, your vitamin D, and biotin. Managing stress and considering options like minoxidil, finasteride, or hormone therapy with the guidance from a trusted healthcare professional can also help. And to help reduce or prevent hair loss, avoid wearing your hair in tight, pulled back hairstyles that could potentially lead to breakage and shedding. You also want to limit your exposure to harmful ingredients and chemicals. So ladies, it's okay to still get your hair dyed, but You want to make sure that you are getting treatments to maintain the strength and the integrity of your hair from root to tip. And additionally, if you do want to try supplements, you could try collagen peptides or biotin. And regular scalp massages can also help with stimulating blood flow to your hair follicles. And some have found benefits with utilizing a vitamin E or rosemary oil. And newer evidence even shows that popular wellness services like red light therapy can prevent hair loss and support hair regrowth.
Thank you, Dr. Mauricio. I will never turn down a scalp massage. And ironically, I just purchased rosemary mint oil for my hair yesterday. So I am so glad that you just reinforced that. So thank you for that. Now we got another allhealthtv.com question. I love it. It's from Phil, and Phil wants to know, Drs. Camejo and Mauricio, I've heard so many things about these new weight loss medicines like Ozempic and Wegovy. I don't know what's true and what's malarkey. I want to lose weight because it makes me look younger, but I need to know more about those drugs before I go all in. So Phil knows about Ozempic, but Phil, he has no idea that the word malarkey hasn't been used in over 50 years, and that's okay. But seriously, where are we with Ozempic at this juncture, Dr. Camejo?
So Kathy, you make an excellent point. And Phil, get your notebook out because we're going to drop some semaglutide knowledge on you. So these medications are popular for a good reason, and they belong to a class of medications they call GLP-1 receptor agonists. They help regulate blood sugar, appetite, and metabolism. And while they can be effective for weight loss, they're not just magic injections. They work best when you combine them with a healthy lifestyle. Like most other medications, they do have a lot of side effects, mostly like GI side effects like nausea, constipation, vomiting, and diarrhea. So it's important that you work very closely with your healthcare provider to track your progress. Now, some common myths are that they're just for diabetes. However, the FDA now have approved them for weight loss, cardiovascular risk reduction, and even obstructive sleep apnea. So overall, they can improve a person's quality of life and support healthy habits, and you need to change your lifestyle. Now, there are also lots of other compounds and counterfeit GLP-1s on the market, so please exercise caution and always discuss with a healthcare provider to determine if they are right for you.
Dr. Camejo, these counterfeit ones that we sometimes see, what's the red flag that we should be staying away from?
So a lot of these small compounding pharmacies, you'll see commercials that they have it very cheaply. A lot of them, we have found that, patients end up in our ER because the compound is not right. They may have too much of the compound, or sometimes they have not enough and they don't work correctly on the patient. So patient experience different things. And we've had a few patients end up in the emergency room with compounded GLP-1s out there.
Thank you for that feedback. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, looking forward to your questions. And our next one comes from Alexi via our YouTube channel. And Alexi asks, Dr. Mauricio, I just turned 40 and I told my trainer Lara that I want to look and feel younger. He said I need to build up muscle mass, which would entail eating way more protein, taking supplements like creatine, and weightlifting. Doctor, it definitely looks good on paper, but is Laird right? And am I really biting off more than I can chew? Okay, Dr. Mauricio, is Alexi's desire to pump iron and bulk up a good idea, or should he focus more on, let's say, weight management, a little bit of toning? I like that.
Yeah, Kathy, both you and Alexi bring up really great questions. So your trainer is absolutely right. Muscle mass naturally declines with age, and you can expect a 3 to 8% decline in involuntary muscle mass loss each decade after the age of 30. This rate of decline is even higher after the age of 60. And when your body loses muscle mass, it slows down your metabolism, it weakens your bones, and it increases the risk of frailty and medical conditions like sarcopenia and osteoporosis. Strength training helps reverse that, improving your posture, your skin tone, and your overall vitality. Higher protein intake anywhere from about 1.2 to 2 grams per kilogram of body weight. And then creatine and resistance training are all evidence-backed strategies to improve your muscle mass, your muscle strength, and keep you looking and feeling younger. You're not biting off more than you can chew. Strength training and focusing on your protein intake are one of the best longevity investments you can make.
Thank you, Dr. Mauricio. We got another YouTube question. This time it's from Monty. And Monty wants to know, esteemed medical professionals, ooh, how formal, as one of many who's trying to turn back the hands of time, I've been doing my research and the word antioxidants keeps popping up. What are they and how do they help in the fight against aging? And which foods or supplements are most effective in boosting antioxidant levels? Great question, Dr. Camejo. I like this guy's style, and he brings up a really good question. What are antioxidants?
So Monty, it always brings me great joy when viewers are advocating for themselves. But aging is partly driven by an oxidative stress, and the process where unstable molecules called free radicals causes damage to our cells and proteins and DNA. So free radicals are natural byproducts of metabolism, but they're also produced in a response to external factors like pollution, UV radiation, smoking, and poor diet. Now, antioxidants help naturalize these free radicals, preventing them from damaging our cells and accelerating aging. So this protection can lead to healthier skin, better brain function. You also reduce inflammation, and you lower the risk of chronic disease like heart disease, cancer, or neurodegenerative disease conditions like Alzheimer's. Now, some antioxidant foods rich include berries. Think of your dark berries like blueberries, blackberries, raspberries, darky leaf greens like spinach or kale, for example, nuts, walnuts, chia seeds, flax seeds, green tea, dark chocolate, and fatty fish. These supplements also you can use are vitamin C, vitamin E, and even CoQ10 can also help, but the whole food approach is best.
Thank you, Dr. C. I actually started my day with some raspberries, blueberries, and blackberries in a shake. So I think I'm getting the hang of this antioxidant game. So thank you for that. This next Facebook question is more than skin deep. It's from Kira, and she wants to know, howdy, Dr. Camejo. I'm a Texas girl who spent a lot of time growing up helping my daddy here growing cattle. As you can imagine, my skin's gotten a little weathered over the years. Now I've obsessively been using SPF and moisturizers over the years, but I've heard a lot about retinoids recently and wanted to get your thoughts. I've always wondered why cowboys called calves the little dog. Okay, I'm getting a little sidetracked there, but retinoids, retinol, is it the same thing, Dr. Camejo, or different?
Well, Kathy, I can actually answer the question because I grew up in Texas. So calves, orphan calves are called little doggies. That's what that references to. But
Okay.
there you go. So now, retinoids, to answer Kira's question, retinoids are a class of compounds derived from vitamin A, and they are widely used in dermatology for anti-aging, also acne treatments and skin renewals. Now, they work by promoting cell turnover. They increase collagen production. They reduce hyperpigmentation. You know how we get older, you get the dark spots on your face. Yeah. Making them one of the most effective ingredients for improving skin texture and reducing fine lines. Now, retinoids come in different forms, and they range from over-the-counter options to prescription strength formulations. Now, you should start with a milder form of retinoid called retinol. So it has the OL at the end. And you can get that from your local pharmacy. This is a great option for beginners. If you want to try something a little stronger, then you're going to progress to retinol, and which is the AL at the end. And this one's a little bit more potent, but stronger than your typical retinoid. And if you need something stronger than that, then that's when you really need to go and talk to your dermatologist, and they can help you identify a prescription strength retinoid, such as Differin, tretinoin, or even Accutane, depending on your needs for your skin. Now, one thing to remember about retinoids is that when you start using them, they can be irritating. And so it's best to start very slow, 2 to 3 times a week at night. And always use SPF on your face in the morning because they do increase sun sensitivity.
Thank you, Dr. Camejo. We got another question from Insta, and it's got a little bit of a sci-fi feel to it. It's from Desmond, who asks, hey, doctors, is it true that scientists and researchers are using things like gene therapy and certain chemicals to slow down or even reverse the aging process? If so, how does something like that even work? And also, please sign me up. Doctors, is this true? How close are they to being able to reverse this? Are we onto something here?
So Kathy, I think we all like to drink from the fountain of youth, right? But Desmond's great question. I want to let Dr. Mauricio answer this one because this one's right up her alley.
So there's a lot of exciting research in this area. Gene therapy, senolytics, and compounds like NAD+ boosters are being studied for their potential to slow biological aging. While some of these therapies are experimental, the longevity science is advancing rapidly, and we may see more practical applications in the near future. So to start with gene therapy, it involves modifying your DNA to treat or prevent diseases. In longevity research, scientists are exploring how genes that regulate aging can be altered to extend the lifespan and delay age-related decline. One approach is telomere extension therapy. Telomeres are essentially the protective caps at the ends of the chromosomes that shorten with age and lead to cellular aging. So gene therapies that are aiming to lengthen these telomeres could potentially reverse aging at the cellular level. Another area of research is called senolytics. As we age, the body accumulates senescent cells, which are damaged cells that stop dividing, but they don't die. And so they kind of call them zombie cells. And they release inflammatory signals, which contribute to the aging and chronic diseases. So these senolytics are a class of drugs that are designed to selectively remove these senescent or these zombie cells, improving the health span and longevity. And then lastly, and probably the most popular one, is the NAD+ boosters. This is nicotinamide adenine dinucleotide, or NAD+, and it's a coenzyme that is essential for cellular energy production, DNA repair, and the longevity gene activation. NAD+ levels naturally decline with age, contributing to fatigue, brain fog, and metabolic decline. So boosting NAD+ levels may reverse some of those aspects of aging, which is why NAD+ infusions have recently become a very popular longevity and wellness trend.
This is fascinating. I mean, let's bottle this up right away. Now, if you got questions, we've got answers. And just in case you missed it the first time around, here's yet another chance to find out where to send in those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, the next question is from Angelina, who reached out to us on allhealthtv.com. You should really check the website out whenever you get a chance. It's chock full of great information. We've had amazing experts on AllHealthGo, and you will not be disappointed. Angelina's question is, Dr. Camejo and Mauricio, I'm training to become a nutritionist, and I'd like to know what are some of the top anti-aging foods that we should include in our daily diet, and why are they beneficial? Okay, love this question, by the way. Doctors, plural. Give me a second. I want you to grab my pen and paper because I need to write this down.
So Kathy, you're quickly becoming one of my favorite students, I must say. And I'm happy to hear that you're going that route, Angelina. Best of luck. But there are many foods that have been shown to have an anti-aging properties, and each of these food groups play a key role in slowing down aging at the cellular level by reducing inflammation, enhancing brain function, supporting skin health, and improving metabolic health. So there is a deeper dive into how these they work and their key nutrients. Now, fatty fish, we've talked about that before, such as salmon, sardines, mackerel, are rich in omega-3. And they really support brain health, they reduce inflammation, and it keeps the skin hydrated. If you eat it at least twice a week. Now, berries, just like you had earlier today, Kathy, for example, the blueberries, the raspberries, the strawberries, they are high in antioxidants and they fight antioxidant stress. So they improve brain function and boost collagen. So aim for about a half to 1 cup daily. Now, leafy greens like kale, spinach, arugula are packed with folate, lutein, and even vitamin K. And these nutrients support DNA repair, detoxification, and bone health. Eat 2 cups daily. And then nuts and seeds, such as walnuts, almonds, flax seeds, are loaded with healthy fats, vitamin E, zinc, and it protects skin, brain, and heart health. A small handful daily should suffice. And then fermented foods like yogurt, kimchi, and sauerkraut provide great probiotics, which enhance gut health, boost immunity, and help reduce inflammation. Include 1 daily.
That immunity boost is so huge, and the inflammation. Thank you, Dr. Camejo. These are such fantastic feedback. Now, we have another question. We are loaded with questions, and thank you for all of you for sending it in. Remember to be able to send in your questions. Just watch our video, and you do not want to miss an opportunity to talk to our doctors and our specialists. So this one comes from Andrew, who reached out to us via Facebook. Hi, Dr. Mauricio. How do stress and mental health play a role in the visible signs of aging, and what can be done to address this? Dr. C, I think you've had some of the best questions, and Dr. M, you're getting a really good one here, so I'm excited. Can you answer that? Because I think all of us can relate to stress and a little of that mental health challenge as well.
Kathy, I couldn't agree more. Andrew, this is such an important question. Thank you so much for reaching out. Chronic stress is a major driver of premature aging, affecting everything from your skin health to metabolism and even lifespan. The key player here is cortisol, which is the body's primary stress hormone. When stress is constant, elevated cortisol levels trigger a cascade of negative effects that speed up aging. High cortisol levels break down collagen and elastin, leading to wrinkles, sagging, and dull skin. Stress can also trigger inflammation, so it can worsen skin conditions like acne, eczema, or rosacea. Chronic stress also lowers the immune function, making the body more susceptible to infections, inflammation, and even cancer. Stress can also affect your DNA. So we talked about telomeres earlier, those protective caps on the ends of the DNA strands, which shorten with your age. And studies show that chronic stress actually accelerates this telomere shortening, leading to premature cellular aging. Long-term stress also raises the risk of heart disease, diabetes, high blood pressure, and neurodegenerative diseases like Alzheimer's. Poor sleep can also be caused by stress, and it affects hormone regulation, your memory, your metabolism, all of which contribute to faster aging. So to combat stress, really try to implement a mindfulness routine. Meditation, breath work, and a good sleep habits are powerful tools for stress management. Staying socially connected can also play a big role in longevity.
Absolutely. Dr. M, how important is sleep, especially when combating stress?
Yeah, it's extremely important. It can help with restoring your levels. It can make your mentality and your focus much better. So those are definitely things that you're going to want to focus on, and make sure you're trying to aim for about 7 to 9 hours of sleep to really get the best effects.
Amazing. Thank you, Dr. M. We have some questions also from Leanne from allhealthtv.com. Thank you, Leanne, for sending it in. Dr. Camejo, what are some of the most effective weight loss strategies for individuals over 40, and why do they differ from younger people? This is a fantastic question, Dr. C.
So after 40, hormonal changes and muscle loss can make weight loss trickier. So strength training, prioritizing protein, managing stress. I mean, we continue to say the same thing, but optimizing sleep all become important. And focusing on whole nutrient-dense foods can also maintain metabolism and reduce inflammation. Now, if you're you should work with a registered dietitian or even a fitness professional to help you set a realistic and safe weight loss goal. Now, understanding that your 40-year-old body differs from your 20-year-old body, it's due to your changes in your muscle mass, hormones, and stress, and many other conditions. So what may have worked for you in the past when you were 20 doesn't work for you the same after you're 40. So make sure that you get with a professional if you're having a hard time, and get with a good diet, and make sure that you can help start losing your weight.
So what you're saying is that I'm not a bright-eyed 25-year-old anymore, Dr. C?
I would never say that to you, Kathy, because you always look great.
Well, thank you. We have another question from Facebook, and it's from Dason. Dr. Mauricio, can intermittent fasting or other trending diets play a role in anti-aging, and are they safe in the long run? This is a great question. Dr. M?
Yeah, so intermittent fasting isn't just about weight loss. It has powerful anti-aging and longevity enhancing benefits. So by cycling between periods of eating and fasting, the body activates mechanisms that promote cellular repair, metabolic efficiency, and reduced inflammation, all of which contribute to a longer, healthier life. Fasting, however, it's not recommended for everyone, especially those who are pregnant and breastfeeding, since the nutrient demands are higher. It's not recommended for people with a history of eating disorders or anyone who has like a high stress level or adrenal fatigue. And especially be cautious when with certain medications and trying this intermittent fasting.
Dr. M, Dr. Camejo, what a pleasure having you Ask the Doc. And to all of you, thank you for sending in your questions. Again, this is Kathy Buccia with the Health Channel, and this is all the time that we have for today. But we'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.